Classic labs and findings, USMLE Step 1 First Aid. 1. Decreased AFP in amniotic fluid or maternal serum. Down syndrome, Edwards syndrome. Number 2. Large granules in phagocytes, immunodeficiency. Chediak-Higashi disease, congenital failure of phagolysosome formation. 3. Recurrent infections, eczema, and thrombocytopenia. Wiskott-Aldrich syndrome. 4. Optotion sensitivity, sensitive, strep pneumonia, resistant, viridins streptococci, including mutans and sanguis. 5. Novobiocin response, sensitive, staph epidermidis, resistant, staph saprophyticus. 6. Bacitracin response, sensitive, strep pyogenes group A, resistant, strep agalacti group B. 7. Streptococcus bovis bacteremia, colon cancer. 8. Branching gram-positive rods with sulfur granules, Actinomyces israeli. 9. Hilar lymphadenopathy, peripheral granulomatous lesion in middle or lower lung lobes, can calcify. Gone complex, primary TB, Mycobacterium bacilli. 10. Thumb sign on lateral neck X-ray. Epiglottitis from Haemophilus influenza. 11. Bacteria-covered vaginal epithelial cells. Clue cells from Gardnerella vaginalis. 12. Cardiomegaly with apical atrophy. Chagas disease from Trypanosoma cruzi. 13. Atypical lymphocytes. EBV. 14. Enlarged cells with intranuclear inclusion bodies. Ally appearance of CMV. 15. Heterophile antibodies. Infectious mononucleosis from EBV. 16. Intranuclear eosinophilic droplet-like bodies. Cowdrey type A bodies, HSV or VZV. 17. Eosinophilic globule in liver. Councilman body, viral hepatitis or yellow fever, represents hepatocyte undergoing apoptosis. 18. Steeple sign on a frontal chest X-ray. Croup, parainfluenza virus. 19. Eosinophilic inclusion bodies in cytoplasm of hippocampal and cerebellar neurons. Negri bodies of rabies. 20. Ring-enhancing brain lesion on CT or MRI in AIDS. Toxoplasma gondii or CNS lymphoma. 21. Samoma bodies. Meningiomas, papillary thyroid carcinoma, papillary serous carcinoma of the endometrium and ovary, and mesothelioma. 22. Delta wave on ECG, short PR interval, supraventricular tachycardia. Wolff-Parkinson-White syndrome. The bundle of Kent bypasses AV node. 23. Boot-shaped heart on X-ray. Tetralogy of Fallot due to right ventricular hypertrophy. 24. Rib notching, inferior surface on X-ray. Coarctation of the aorta. 25. Heart nodules, granulomatous. Ash-off bodies, rheumatic fever. 26. Electrical alternans, alternating amplitude on ECG. Cardiac tamponade. 27. Anti-neutrophil cytoplasmic antibodies, ANCAs. Microscopic polyangiitis and eosinophilic granulomatosis with polyangiitis, MPO ANCA and P-ANCA, granulomatous with polyangiitis, Wegener, PR3 ANCA, C-ANCA, and primary sclerosing cholangitis, MPO ANCA and P-ANCA. 28. Hypertension, hypokalemia, metabolic alkalosis. Primary hyperaldosteronism, Conn syndrome. 29. Enlarged thyroid cells with ground glass nuclei with central clearing. Orphan any eye nuclei, and papillary carcinoma of the thyroid. 30. Mucin-filled cell with peripheral nucleus. Signet ring, gastric carcinoma. 31. Antitransglutaminase, antigliadin, anti-endomysial antibodies. Celiac disease, diarrhea, weight loss. 32. Narrowing of bowel lumen on barium X-ray. String sign, Crohn's disease. 33. Lead pipe appearance of colon on abdominal imaging. Ulcerative colitis, loss of haustra. 34. Thousands of polyps on colonoscopy. Familial adenomatous polyposis, autosomal dominant mutation of APC gene. 35. Apple core lesion on barium enema X-ray. Colorectal cancer, usually left-sided. 36. Eosinophilic cytoplasmic inclusion in liver cell. Mallory body, alcoholic liver disease. 37. Triglyceride accumulation in liver cell vacuoles. Fatty liver disease, alcoholic or metabolic syndrome. 38. Nutmeg appearance of liver. Chronic passive congestion of liver due to right heart failure or Budd-Chiari syndrome. 39. Anti-mitochondrial antibodies, AMAs. Primary biliary cholangitis, female cholestasis, portal hypertension. 40. Low serum ceruloplasmin. Wilson disease, hepatolenticular degeneration, Kaiser-Fleischer rings due to copper accumulation. 41. Migratory thrombophlebitis, leading to migrating DVTs and vasculitis. Trousseau's syndrome, adenocarcinoma of pancreas or lung. 42. Basophilic nuclear remnants in RBCs. Howell-Jolly bodies, due to splenectomy or non-functional spleen. 43. Basophilic stippling of red blood cells. Lead poisoning or sideroblastic anemia. 44. Hypochromic microcytic anemia. Iron deficiency anemia, lead poisoning, thalassemia, fetal hemoglobin sometimes present. 45. Hair on end or crew cut appearance on X-ray. Beta thalassemia or sickle cell disease, marrow expansion. 46. Hypersegmented neutrophils. Megaloblastic anemia, B12 deficiency with neurologic symptoms, or folate deficiency, no neurologic symptoms. 47. Antiplatelet antibodies. Idiopathic thrombocytic purpura. Idiopathic thrombocytopenic purpura, ITP. 48. High level of D-dimers. DVT, PE, DIC. 49. Giant B cells with bilobed nuclei with prominent inclusions, owl's eye. Reed-Sternberg cells in Hodgkin lymphoma. 49. Sheets of medium-sized lymphoid cells with scattered pale, tingible body-laden macrophages. The starry sky histology. Burkitt lymphoma, translocation 814 with c-MYC activation associated with EBV. Starry sky made up of malignant cells. 50. Lytic, punched out bone lesions on X-ray. Multiple myeloma. 51. Monoclonal antibody spike. Multiple myeloma, usually IG or IgA. Monoclonal gammopathy of undetermined significance, consequence of aging. Waldenstrom, M protein equals IgM, macroglobulinemia, or primary amyloidosis. 52. Stacks of RBCs. Rouleau formation, high ESR, multiple myeloma. 53. Eosinophilic peroxidase positive granular inclusions in granulocytes and myeloblasts. Our rods. AML, especially the promyelocytic M3 type. 54. White blood cells that look smudged. CLL, almost always B cell. 55. Tennis racket-shaped cytoplasmic organelles, EM, in Langerhans cells. Burbeck granules in Langerhans cell histiocytosis. 56. Brown tumor of bone. Hyperparathyroidism, or osteitis fibrosa cystica, deposited hemosiderin from hemorrhage, gives brown color. 57. Soap bubble in femur or tibia on X-ray. Giant cell tumor of bone, generally benign. 58. Raised periosteum creating Codman triangle. Aggressive bone lesion, osteosarcoma, Ewing sarcoma, or osteomyelitis. 59. Onion skin periosteal reaction. Ewing sarcoma, malignant small blue cell tumor. 60. Anti-IgG antibodies. Rheumatoid arthritis, systemic inflammation, joint pannus, boutonniere, and swan neck deformities. 61. Rhomboid crystals, positively birefringent. Pseudogout, calcium pyrophosphate dihydrate crystals. 62. Needle-shaped, negatively birefringent crystals. Gout, monosodium urate crystals. 63. Elevated uric acid levels. Gout, Lesch-Nyhan syndrome, tumor lysis syndrome, loop and thiazide diuretics. 64. Bamboo spine on X-ray. Ankylosing spondylitis, chronic inflammatory arthritis, HLA B27. 65. Antinuclear antibodies, ANAs, anti-Smith and anti-dsDNA. SLE, type 3 hypersensitivity. 66. Antihistone antibodies. Drug-induced SLE, hydralazine, isoniazid, phenytoin, procainamide. 67. Anti-topoisomerase antibodies. Diffuse scleroderma. 68. Keratin pearls on a skin biopsy. Squamous cell carcinoma. 69. Bloody or yellow tap on lumbar puncture. Xanthochromia due to subarachnoid hemorrhage. 70. Eosinophilic cytoplasmic inclusion in neuron. Lewy body, Parkinson's disease, and Lewy body dementia. 71. Extracellular amyloid deposition in gray matter of brain. Senile plaques, Alzheimer's disease. 72. Depigmentation of neurons in substantia nigra. Parkinson's disease, basal ganglia disorder, rigidity, resting tremor, and bradykinesia. 73. Protein aggregates in neurons from hyperphosphorylation of tau protein. Neurofibrillary tangles in Alzheimer's disease, and PIC bodies in PIC disease. 74. Silver staining spherical aggregation of tau proteins in neurons. PIC bodies, PIC disease, progressive dementia, changes in personality. 75. Pseudopalisading tumor cells on a brain biopsy. Glioblastoma multiforme. 76. Circular grouping of dark tumor cells surrounding pale neurofibrils. Homer-Wright rosettes. Neuroblastoma medulloblastoma. 77. Waxy casts with very low urine flow. Chronic end-stage renal disease. 78. Nodular hyaline deposits in glomeruli. Kimmel-Still-Wilson nodules, diabetic nephropathy. 79. Podocyte fusion or effacement on electron microscopy. Minimal change disease, child with nephrotic syndrome. 80. Spikes on basement membrane, dome-like subepithelial deposits. Membranous nephropathy, nephrotic syndrome. 81. Red blood cells, casts in urine. Glomerulonephritis. 82. Tram track appearance of capillary loops of glomerular basement membrane on light microscopy. Membranoproliferative glomerulonephritis. 83. Antiglomerular basement membrane antibodies. Goodpasture syndrome, glomerulonephritis, and hemoptysis. 84. Cellular crescents in Bowman capsule. Rapidly progressive crescentic glomerulonephritis. 85. Wire loop glomerular capillary appearance on light microscopy. Diffuse proliferative glomerulonephritis, usually seen with lupus. 86. Linear appearance of IgG deposition on glomerular and alveolar basement membranes. Goodpasture syndrome. 87. Lumpy bumpy appearance of glomeruli on immunofluorescence. Post-streptococcal glomerulonephritis due to deposition of IgG, IgM, and C3. 88. Necrotizing vasculitis, lungs, and necrotizing glomerulonephritis. Granulomatosis with polyangiitis, Wegener, PR3 ANCA, C ANCA, and Goodpasture syndrome, anti-basement membrane antibodies. 89. Thyroid-like appearance of kidney. Chronic pyelonephritis, usually due to recurrent infections. 90. White blood cell casts in urine. Acute pyelonephritis. 91. Renal epithelial casts in urine. Intrinsic renal failure, such as ischemia or toxic injury. 92. HCG elevated. Choriocarcinoma, hydatidiform mole, occurs with and without embryo and multiple pregnancy. 93. Dysplastic squamous cervical cells with racinoid nuclei and hyperchromasia. Coilocytes. HPV predisposes to cervical cancer. 94. Disarrayed granulosa cells arranged around collections of eosinophilic fluid. Call Exner bodies, granulosa cell, tumor of the ovary. 95. Chocolate cyst of ovary. Endometriosis frequently involves both ovaries. 96. Mammary gland, blue domed cyst. Fibrocystic change of the breast. 97. Glomerulus-like structure surrounding vessel in germ cells. Schiller-Duval bodies, yolk sac tumor. 98. Rectangular, crystal-like cytoplasmic inclusions in Leydig cells. Ranke crystals, Leydig cell tumor. 99. Thrombi made of white-red layers. Lines of Zahn, arterial thrombus, layers of platelets and red blood cells. 100. Hexagonal, double-pointed, needle-like crystals in bronchial secretions. Bronchial asthma, Charcot-Leyden crystals, eosinophilic granules. 101. Desquamated epithelium, casts in sputum. Kirschmann spirals, bronchial asthma, can result in whorled mucus plugs. 102. Honeycomb lung on X-ray or CT. Idiopathic pulmonary fibrosis. 103. Colonies of mucoid Pseudomonas in lungs. Cystic fibrosis, autosomal recessive mutation in CFTR gene leading to fat-soluble vitamin deficiency and mucus plugs. 104. Iron-containing nodules in alveolar septum. Ferruginous bodies, asbestosis, increasing chance of lung cancer. 105. Bronchogenic apical lung tumor on imaging. Pancoast tumor can compress cervical sympathetic chain and cause Horner syndrome.